you find passing urine. Sometimes the child poos and passes urine at the same time. So the mothers panic. If I was a mother, I also would panic. When they come saying the child hasn't passed urine. So sometimes the child may pass urine 5-6 times. Children sometimes cry during passing urine. Of course, if it's a male, we are more worried because that in small children, urine infections are common in males. But again, the fullness of the bladder, the wet nappy also can. And most of the time, the child is crying. Now, talking about the skin or male, the foreskin of the boy is generally the meatus may be small. And you cannot withdraw the foreskin till they are about 4 or 5. Attempting to do so may damage the child. Can only be done by a very experienced person. Even when I do it with extreme caution. So please wait till 4 years before withdrawing the foreskin and cleaning the area. Then about pooing. Now there are children who may, like I said, who pass poo 20 times, 25 times a day. Sometimes it will be like paripu. Sometimes it goes like milk. Sometimes it goes like greenish matter. So that is not a thing to worry about. Sometimes the children pass a lot of flatus and explosives out and the fecal matter shoots out. So the child's enzymes are just developing to digest milk, and that is common. It's called lactose intolerance. The milk is not digested, and as the gut matures, it generally subsides. Of course, you have to seek medical help if the area surrounding the anus, which you see when you wash in child, become very red, because a simple local application after you wash the child will prevent this redness. Then the child may not pass stools for 10-15 days, which is normal. It is imperative that if the child is constipated, to do a thyroid hormone test, which is done routinely in all children, because you pick up a very treatable condition, which is the commonest cause of reversible mental development. So that is done routinely, should be done routinely in all hospital, and is done in my ward and in our neonatal unit, because it's essential. Of course, if it's normal, then if the child doesn't pass stools for 10 to 15 days, don't worry. Unless the child is uncomfortable, passing like pellets, or sometimes there is a bit of bleeding after the child passes stools, then you would go and see a doctor.